Hi, everyone. I hope you guys are all doing really, really well. Thank you for joining us today. For those of you that don't know me, my name is Pippa Karikari. I am a qualified healthcare assistant, community support worker. I was previously a social work recruiter for the charity Think Ahead, a very great established charity here in the UK. I'm now in my final year doing combined social policy and health and wellbeing at Liverpool Hope University. On top of that, I am a very passionate community wellbeing advocate, and I was also first Princess of Most Proud of Africa UK 2019. So like I said before, I'm really passionate about race and diversity, as I feel it plays a huge part in the wider community and in ordinary life, of course. As we have witnessed this year, there's been huge events in terms of the pandemic and the racial civil rights in the Western world. And these issues do have a disproportionately negative effect on ethnic minority groups. It has like a sort of bad trickle-down effect to these groups that a lot of people don't really realise. So despite these hard times, I have utilised my resources, connections to kind of campaign online and advocate for strategies to cope and changes that can be made that will benefit all people in society. And I really want to build a strong partnership here in the UK. Thankfully, I have had help with that, and I've been able to engage and collaborate with a number of media platforms, including Yanga TV, the Beat FM radio, and the Liverpool Echo News. So I've been able to raise awareness on social issues that affect women and Black women and those that are neurodivergent, which what that term means is basically that people that think atypically, so people that are autistic, ADD, etc. So yeah, thank you for joining in arguably one of the most iconic Black History Months since time began. We've been able to see really great revelations and structural changes happening across society in different sectors, in education, employment, healthcare, media, in fact, corporate, business, everything. And I think even in the news, they said that this year has been the greatest and most influential civil rights movement since records began. So that is amazing. And do pat yourself on the back if you've been a part of that movement, if you've been a part of any sort of positive change towards the society that you want to see. And if not, guess what? Now's your chance to really take the reins with these type of things, these leadership opportunities, advocacy, public and social awareness traits are really big for employers this year. I've seen in so many webinars and discussions that the one thing that they're really looking for is, you know, social leaders and people that utilize their resources and show resilience really in the face of adversity. So it's really good to get stuck in if you get the chance. And don't fret, I'm here to tell you about an amazing opportunity, amazing chance to get stuck in and be proactive and really get involved with changing and contributing towards some real social good. And that is through an organisation known as the Karikari Foundation. This is a foundation a charity that myself and my family have started this year. As I said before, we've seen some unique intersectional challenges for the Black community, coupled with the ongoing health pandemic. So what we have put forward, what we've proposed is a solution to tackle this through fundraising, PPE, personal protective care, so that's basically face masks, the aprons, the whole 9 yards. These care supplies will go directly towards individuals that are often overlooked. Now, the work that we are doing is going to be based out in Ghana, where I am, of course, originally from. And it will be delivered to young and infant individuals there that really need the care and the support. And yeah, a lot of people ask me, you know, why do I want to go abroad? Why do I want to make this global? Why don't I just be very simple and succinct and just do it based here in the UK? But I want to have international charitable impact, and that's because of two reasons, really. All over the world, we have a great problem when it comes to, one, funding and taking social care seriously, and two, ensuring that foreign aid or profits from charitable social enterprises really get to the community that they're trying to help. So that is why we set this project up, because I wanted to utilize the knowledge and the resources we have here in the UK and sort of manage it myself through my own care expertise so that I could effectively support the great work already being carried out in Ghana, because let's not forget the care workers in Ghana are doing an amazing job. The government and the setup there is completely different to what we have in the UK. And I really feel like they are making the most, considering the political stance that goes on there is quite different. You're probably thinking, how are we going to accomplish this great mission? Practically, if you look at our website, and I will put all the links and whatnot in the chat box, and we have this adorable baby boy on the front page of the website. Please take a look. It's just for that. He's so cute. But there you'll find further details and information about our purpose, our mission, how we're going to do it. But I will give you a brief overview of our core plan. So like I said, we want to fund care supplies. That is the main goal. That includes reusable feeding bibs that will really benefit the physically disabled children, face masks for staff, aprons as well, and antiseptic cream, all those sort of things. And we have a plan to make it as eco-friendly as possible as well. One of our values is sustainability, particularly environmental sustainability, as we know with the climate change issue that's going on. Everything will be, of course, where possible, biodegradable, and it will be packaged in a reusable portable box. So we will be sending these to care homes and supported living facilities that do tremendous work caring for these vulnerable children that range to, premature, tiny 2-week-old newborns to toddlers and older children. Many of whom have quite severe learning disabilities. Some are unfortunately terminally ill or have multiple health conditions. So we really wanted to give them the best high quality and most hygienic healthcare that they deserve. Now, so our fundraiser has managed to get funding for, I'd say, around 10 of these care boxes, but we'd really love to get even more support from our amazing, great community even further. And that can be done in different ways, from reposting us, retweeting us, following us on all our social medias, spreading the word, and of course, one of the best ways, which is donating. Anything from £5, £25, whatever you can do would be a massive help. And of course, I'll put the donation link. Donation link is basically everywhere at this point, but it's in the bio of all my social media, and I will put it in the chat. Last but not least, you guys may be thinking of ways you can really get involved other than the usual social media engagements. We do have some great upcoming voluntary and work experience opportunities. So for those of you out there in the future or presently, or know anybody that has a keen interest in health, in social care, psychology, or the well-being of children in general, public services, you can contribute to our online campaigns. This can be done through written entries, articles, social media takeovers, interviews, and really get promoted on our online platforms. Of course, it's great for your CV, for work experience, and further networking opportunities. So we'd love to hear from you. Please do get involved, even if it's just a comment or a suggestion to us, or a well done or whatever. Do email us or chat to us on social media. That's at Karikari Foundation. So yeah, if you do have any questions, just email me or message me. And if you have any queries about working in social care, if you need any help or advice with healthcare, social care, public service work in general, you are able and free to contact me. And yeah, that's it really. So thank you so much for listening. Thank you all, and yeah, take